So it is the principle. You are telling that principle. What is the principle? Principle. Why? Why? What the surface tension of what? No, of sulfur. We are adding sulfur, right? It reduces the surface tension of sulfur and it sinks down. Okay. Is not present. If the bile salt is present, what is the inference? The patient might have what? What jaundice? What are the types of jaundice? Hepatocellular. And okay. What will the patient have? Then what? Obstructive jaundice, right? In obstructive jaundice, what type of bilirubin is raised? What type of bilirubin? What are the types of bilirubin? Okay, you do the test, then we will answer. Okay, start the test. Take 2 test tubes. Koi. Precipitate. What is the principle? কি বললি আরেকবার বলে দে. What is the principle? যেখানে বেখানে নয়, ইংলিশে বল. What is the principle? Practice কর. Where is the bile salt? Bile salt. When the bile salt is present, what happens?
The sulfur powder will sink.
Why? What is the principle?
Because of surface lowering of surface tension.
So what is the principle? When bile salt is present in the urine, it reduces the surface tension of the sulfur and it sinks at the bottom, right? এইভাবে বলবি, ঠিক আছে? প্র্যাকটিস করবি।